Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, founder of the Facebook group Migraine Nation, chronic daily migraine survivor and migraine strategist. I am here today with Dr. Vincent Martin, MD. Dr. Martin is the president of the National Headache Foundation, and he is also the director of the Headache and Facial Pain Center at the University of Cincinnati. How are you doing today, Dr. Martin?
It's a great day.
Good to see you.
Good to see you.
Today we have a very interesting topic that we've not talked about before on the podcast. We are going to talk about Meniere's disease. Meniere's disease comes up a lot in the migraine chats. We have a lot of people in our community that have been diagnosed with this condition, and we actually have, it's been in the news a lot lately because there's a celebrity that was diagnosed with it. Jessie J was diagnosed with Meniere's disease recently, and so it's been on the news a lot. So we thought it was a good time to chat about what it is and why it's prevalent in our community. So let's start, Dr. Martin, by just with a general definition of what Meniere's disease is.
Well, Meniere's disease is a disease of the inner ear, basically where in the inner ear, there's like a little seashell in there that's fluid filled. And then when the pressures in that fluid filled structure go up, it can cause a variety of different symptoms. And the biggest one would be vertigo, which is either a sensation the room is spinning around, or the person has the perception that they're moving in relationship to the room. They may not perceive it spinning. Mm-hmm. They also usually have muffled hearing or ringing of the ears. And then the final thing they often have is hearing loss. And actually hearing loss is needed to make the diagnosis.
Okay. Does it affect both ears, one ear?
It could be on one side or it could be on both sides.
Okay. So what are the most common symptoms then? So it's you have to have the hearing loss and the vertigo. Are those the most common things that people usually experience first?
It's usually vertigo, and then sometimes the hearing loss can be subtle, particularly if it's been going on for a period of time. The person may not even notice themselves whether that they have hearing loss, although usually their spouse notices it. But those are probably the two most common symptoms would be the dizziness / vertigo and the hearing loss.
Okay. So, but many people apparently also experience migraine when they have Meniere's disease. Am I correct?
Absolutely. Migraine is more common in patients with Meniere's disease, and Meniere's is more common in people with migraine.
Okay. Do we know why that is?
Well, there could be, we don't know for sure, but there could be some common link that causes that. For example, there may be because this fluid-filled structure within the inner ear has an increased pressure, that maybe it's linked to high spinal fluid pressures, which might aggravate migraine and produce migraine-like headaches, and also potentially cause Meniere's disease. So there could be some connection through that, but the honest to God truth is we don't really know.
Okay. So what are some signs if, you're someone watching the webcast and you have migraine, what are some signs that you could have Meniere's disease as opposed to classic migraine?
Well, there's a lot of different causes of dizziness because that's what usually people present with. They usually present with dizziness. So the first thing you have to do is distinguish whether it's dizziness from the inner ear or whether it's dizziness from your cardiovascular system. First you have to decide whether you're dealing with dizziness when you stand up, or is your heart racing. That can indicate something called dysautonomia, which is a disorder of the autonomic nervous system, which is your fight or flight nervous system, versus dizziness that might be coming from the inner ear called vertigo, where the room spins around. Now, I don't want everyone to think that if they do have intermittent bouts of vertigo that everyone has Meniere's disease, because there's a lot of different causes of vertigo in a migraine patient. But if you have dizziness or vertigo that's lasting more than about 6 weeks, on and off continuously, then that's when we get concerned, because there's a lot of causes of vertigo, including things like viral infections of the inner ear. That's called a labyrinthitis, and then there's something called vestibular migraine, which is where migraine can kind of mimic vertigo, and there's there's something called an acoustic neuroma, which is a benign brain tumor that sometimes needs to be excluded as well, and that's not very common either, but it does occasionally happen. So.
Okay. Well, you sort of read my mind, because my next question had to do with the overlap of vestibular migraine and Meniere's disease. There's a lot of overlap in the diagnosis and the symptoms. So how are they different, the two, vestibular migraine and Meniere's?
Well, sometimes they can be difficult to distinguish, but hearing loss is going to be more common in people with Meniere's disease.
Okay.
So that would be one differentiating feature. And then the differentiating feature for vestibular migraine is the fact that it often has migraine-like symptoms with it. And at least half the time or more, it's associated with a migraine attack. So you might have vertigo plus sensitivity to light, noise, or nausea, or other migraine characteristics like, migraine head pain where the pain is one-sided, or it's throbbing, or it's moderate to severe. So vestibular migraine most of the time has some relationship to a migraine attack.
Okay. You mean in time, as in they happen? Do you mean relationship in time, as in they happen at the same time?
In time.
Okay.
In time. And then there are other distinguishing factors. Meniere's occurs at a slightly later age. There's no female predominance like there is in migraine, so it's pretty equal between men and women. So there's some differences between the two disorders. And what's really interesting is the fact that about 40% of the time you can have coexistence of vestibular migraine along with Meniere's. Right. So that makes the diagnosis even more difficult. And really, a lot of this would be ferreted out by very specific tests done by an ear, nose, and throat physician who specializes in vertigo. There's a variety of different tests, both the hearing tests, and there's a variety of other vertigo tests to tell whether, where the vertigo is coming from and help diagnose Meniere's disease.
Right. So you did just read my mind. I was going to ask if you could have both of them, and you can. So my next question, I just wanted to elucidate for people the difference between the regular dizziness that can often show up when we have migraine. I mean, a lot of us really do have a symptom where we get dizzy when we have migraine, but it doesn't necessarily mean we have either Meniere's or vestibular migraine. Can you maybe cover that a little bit?
Sure. There's one disorder called, it is kind of a fancy medical term, but it's called migraine with brainstem aura. Mm-hmm. And you can get an aura, which is kind of an electrical wave that goes across the brain that involves the brainstem, which is in the back of the head, and mm-hmm. you can get vertigo with that. And that mm-hmm. does not necessarily mean that you got vestibular migraine, and it doesn't necessarily mean that you've got Meniere's disease as well. Right. But oftentimes you have other symptoms with that, like you might get double vision, or you might have tinnitus or other signs that the brainstem is involved as well. With that. So I think that's probably the way that you differentiate it, but there's lots of other causes. Like for example, if you have vertigo that just lasts for a few seconds to a minute, mm-hmm. that often is something called benign positional vertigo, which also is more common in persons with migraine. But that's mm-hmm. where you kind of turn your head to one direction, and then you'll have spinning of the room that lasts for a very short period of time. And then, then that might happen again, so that a short-lived vertigo usually falls into that category. When you have more long-lived attacks, like anywhere from 10 minutes up to hours, or sometimes even days, that's probably more characteristic for other disorders, that we've already talked about, including Meniere's disease as a cause for the vertigo.
Okay. And just an interesting question that I bet people are thinking right now. Why does migraine show up so often with these weird symptoms like dizziness? Why does this relationship exist? Is it just the part of the brain that it's affecting?
Well, there's lots of thoughts about that, at least in terms of the connection between migraine and Meniere's disease. Some people think that migraine may actually damage the inner ear and lead to increased pressures within the inner ear. A lot of the same, the pain pathways and the pathways involved in balance are very intimately connected. Mm-hmm. So consequently, it's not a great surprise in my mind that those pain pathways get activated, as well as the pathways that are involved in your balance as well. So a lot of the same chemicals and a lot of the same what we call receptors, which is where those chemicals in the brain bind, that are found on the trigeminal nerve and the whole trigeminal system, which is involved in migraine. That's the main nerve involved in migraine. Are also involved. They're also found in the nerves that involve the balance center. So there's a lot of overlap between these brain chemicals, and I think that's probably why you see these two disorders so intimately related with vestibular migraine.
Okay. Do the symptoms of Meniere's disease and people with Meniere's disease, do they respond to migraine treatments?
No, not typically. So if it's straight Meniere's disease, then there's two different therapies you'd use. Well, it's probably three, actually. One is there are some very specific meds that cause a little constriction of arteries, and they think that might improve things. But the mainstay of therapy are going to be water pills.
Okay.
And the one that's most commonly used is a combination pill of hydrochlorothiazide and triamterene called Diazide. But you can use a medication called furosemide or Lasix, or other water pills can sometimes be used. The third therapy that's used are therapies called the benzodiazepines. They're like basically sedatives. And a very small dose of Valium is sometimes, that's an old drug that we used back in the 70s and 80s, is sometimes used to kind of suppress the vertigo attacks.
Okay.
Now, vestibular migraine is a different animal. So vestibular migraine, at least in my experience, does seem to respond to migraine therapy. So a lot of the preventive therapies that we use for migraine do seem to reduce the frequency of attacks of vertigo as well. So the ones I commonly use would be like topiramate and verapamil and some of the antidepressants like amitriptyline or Elavil is the trade name for that. So we use a lot of those medications, and we have a fair luck in treating vestibular migraine with those preventive medications.
Okay. So is there anything else you would like to add to this discussion on Meniere's disease?
Well, what I would say is this: is if you have a short-lived attack of vertigo, as we said before, lasting seconds to minutes, don't think that you've got Meniere's disease, because that's probably not what you have. If you have episodes of vertigo that last for weeks to months, then you may want to get some evaluation looking for Meniere's disease, as well as other causes of vertigo, such as vestibular migraine and a variety of other disorders that involve the inner ear. But most cases of vertigo are going to be self-limited. They're going to last for 4 to 6 weeks. A lot of times you'll take medications for vertigo. There's one called Antivert, which is a medication to try to help with the dizzy episodes as well. And usually the vertigo will subside. So just because you have vertigo does not mean that you have Meniere's disease. So I don't want people coming away with the idea that every attack of vertigo is going to be Meniere's. In fact, I would even say this, that most attacks of people with vertigo are not from Meniere's disease.
Right.
It's the other things are much more common. Vestibular migraine is more common, and benign positional vertigo, where you get this short-lived attacks with moving your head, far more common than Meniere's disease.
It is a very rare disease. I think it's 0.2% of our population has it. It's quite rare. But we see it in the migraine chat rooms because it is associated with migraine. So I wanted to make sure we touched on it for our group, for our population and the people who watch us. I wanted to make sure that everyone knows who they can see. So if they did find this to be something they thought they had, would they go to their headache specialist? Is it usually ENTs that they talk to?
Most people would go to an ear, nose, and throat doctor, but there are also very specialized doctors that deal with dizziness and other neurologic disorders of the inner ear. They're called neuro-otologists. And at major medical centers like we have at Cincinnati, we have several doctors that do this that are neuro-otologists. They're the ones with special expertise in this area.
Okay. All right. Well, thank you so much. And thank you everyone for joining us today on Heads Up. And please join us again next week for the weekly podcast of the National Headache Foundation. Bye-bye.